Hi everyone, welcome back to Nurse Katherine here. Today I'm actually recording my video on the way to work. It is currently 6:12 in the morning and the sun is out. It's a beautiful day and I want to share with you all today about delegation. I have a nurse extern with me right now. She's doing her externship for 5 weeks with me. And yesterday she brought up the subject of delegation and how she's not really quite sure what to delegate. She feels bad delegating and she just kind of wants to be able to do it all on her own. But truthfully, we all know that cannot happen. We all have learned in nursing school that you need to delegate. We've had those delegation questions. You get asked on the NCLEX about delegation questions. So what do we delegate? How do we delegate? How can we do it in a professional manner that does not demean the other person or that does not come off in a way that is rude? Before we get into what we can delegate and what a nurse can delegate and how to delegate, let's just talk about why we delegate. We have to delegate tasks because we cannot do it all. A nurse has their role, and then a nurse aide also has their role. If we were given both of those roles, it would not go smoothly, your day would not go smoothly, and you just simply would not be able to complete all your tasks that need to get done. When you are going into a new job, make sure you read the description of your RN role, but you also read the description of your nurse aide, whether that's a PCA, a CNA, a medical tech, anything like that. Make sure you know what they are allowed to do, so you're not delegating tasks to them that they are not supposed to be doing. So at this point, you know why you need to delegate. You know what you can delegate. So what was posted on that CNA's, PCA's, med tech's role responsibility, as well as yours. So you know what you can delegate at this point, and let's go into how you delegate. This seems to be the hardest part for all the students I have been precepting, and just for me personally, when I was a graduate nurse and even when I was a student nurse, delegating was hard. I felt bad. I felt like I was bothering somebody, and I felt like I got a lot of kickback when I was delegating. Say you want to delegate a task such as putting a heart monitor on a new admission who came up to your unit. So in this circumstance, the nurse is doing all the admission questions, and on our unit at my hospital, the PCA is typically more responsible for getting the orthostatic vitals and helping the patient into the room. And that's typically about what they do, and then they give the bathing supplies, all of that, all the care package needs that we give out when somebody is admitted. So in this circumstance, I would say to my PCA, as I'm standing there doing the admission with the patient and asking all the questions, I would say to them, let's say my PC's name is Sarah. So we'll go Sarah. Hey Sarah, it looks like this patient needs telemetry. I would actually say the patient's name. But it looks like this patient needs telemetry. Would you mind go grabbing a tele box and the leads and putting them on tele? Simple as that. That's delegating right there. So I was doing the admission. She could see that I was busy doing something else and not just standing around or at the nurse's station not doing anything. So yeah, then that's easy as that. You just ask them simply, could you please do this, and why I do that. So let's talk about a circumstance where you would not delegate. If you have completed everything you needed to complete, and you're just kind of hanging around waiting for the next thing to come, and your patient calls out and says they need to use the restroom. You see your PCA or CNA is busy, you're not going to delegate that task to them. You yourself are going to go help that patient get to the restroom, use the bedside commode, use the bedpan, whatever they need to do. It is not only the PCA or CNA's job to take somebody to the bathroom. That also is your job as a nurse. So that would be something you would not delegate. Your PCA is busy, your CNA is busy. Now you need to do something to help your patient. That wouldn't be something you would make a patient wait for. Another task that could go both ways would be if you have a patient who is a total feed. I don't like to label patients, but that's what it's charted in the computer. So in that circumstance, they need somebody to help them eat at all meals, all times, and they cannot physically lift the fork or the spoon by themselves. So you have to feed them. So in that circumstance, if your PCA or CNA is too busy, you should not be delegating that to them and making your patient wait another hour and a half to eat their meal. So in the end, make sure you're delegating tasks that really truly need to be delegated, and that you can absolutely not get to that circumstance or that situation to help that patient out. Remember, when you're delegating, that you are delegating the right task to that person. It is for the right reason, and of course that it's the right person. It's the right person to do that job. Also, remember, when you are delegating, be very kind about it. Be very purposeful about what you're saying. Say it with a smile on your face, and make sure you tell the person why you cannot do that task. Like yesterday, I had a circumstance where I had to put 2 people on heart monitors, but I only had about 15 minutes left of my shift, and I was still trying to get medications done. So I asked my PCA, I said, hey, would you mind putting the heart monitor on the patient in the room in 23 while I put the heart monitor on the patient in 24? So I split it up evenly. That's also another great way to delegate, is be like, hey, we need to get multiple things done. I will do this, and I need you to do this to help me out. 6:33 in the morning right now. I'm about to pull into work, about to pull into the parking garage. So I am gonna go, but I hope this helped you guys. I hope this helped you just learning more about delegation and how you can delegate and what to delegate. And I hope you all have a blessed day. I will see you in the next video. Please comment below with any questions you have about delegation, and also any other topics you would like me to touch on. I have an open mind. I'm willing to touch on almost anything. So yes, comment below. Please like, share, comment, and of course, make sure to subscribe to my channel. All right, I'm here. Hopefully it's a great day. It will be. You gotta go into it with the right attitude, right? All right, adios, guys.